Coming to another malignant salivary gland tumor, acinic cell carcinoma. It is defined as a low or intermediate grade malignant epithelial neoplasm of the salivary gland, which is characterized by serous acinar cell differentiation. These serous acinar cells have cytoplasmic zymogen granules. Serous acinar cell differentiation is seen in at least some of the neoplastic cells. Approximately 6 to 8% of all salivary gland neoplasms are acinic cell carcinomas. Acinic cell carcinoma accounts for 10 to 17% of primary salivary gland malignancies. It is seen in wide age range. So it is seen in children and young adults. Older adults are also affected. According to many of the studies, the median age range is 40 to 50 years. It is second most common salivary malignancy in children after mucoepidermoid carcinoma. Acinic cell carcinoma is third most common salivary malignancy in adults after mucoepidermoid carcinoma and adenoid cystic carcinoma. Acinic cell carcinoma is slightly more common in females than in males. The ratio is 1.6 is to 1. The most common site of acinic cell carcinoma is parotid gland. Submandibular, sublingual, and minor salivary glands are rarely involved. The most common site in the oral cavity are buccal mucosa and upper lip. Radiation is important risk factor in case of acinic cell carcinoma. It is believed that acinic cell carcinoma has familial predisposition. Coming to clinical features, the typical clinical presentation is slow-growing mass. It is painful and fixation to surrounding tissues is seen. The cranial nerve 7 dysfunction is not common. Cervical lymph node metastasis is rarely seen in case of acinic cell carcinoma. Up to 10% of the cases have cervical lymph node metastasis. After excision of the tumor, the mass is well demarcated and is often homogeneous. Microscopically, different patterns are seen. Most common pattern is solid and microcystic pattern. This pattern shows solid sheets of acinar cells. Numerous small cysts are also seen. Acinar cells are largely polyhedral in shape. The nuclei is small, dark and eccentric, and cytoplasm is basophilic and granular. This picture shows sheets of acinar cells accompanied by cystic spaces. The treatment of acinic cell carcinoma is complete local excision. It is followed by postoperative radiotherapy. 5-year survival rate is 82%, whereas 10-year survival rate is 68% and 25-year survival rate is 50%. Thanks.